all of our Orange County residents using data. So this is our website, very simply advanceoc.com. You will see that we say we're trying to fulfill the dream. And what is the dream? The dream is here. I mean, we live in this beautiful place. So many parts of the country is being slammed by a lot of snow and other things, and we get to live here. But the promise of living here is also the promise that we can see each other thrive, right? And if we don't have resources equally, if we don't have access to resources equally, then we are not allowed to thrive in that way, right? So that's what fulfilling the dream means. So what we started out doing in 2019 when we were founded was to decide, gosh, can Orange County get on the same page in terms of like, what are the needs of the community and how do we measure those needs? When we asked, one community-based organization and another community-based organization, or rather, when we asked one hospital and we asked another hospital, what are the greatest needs in Orange County? And then everyone would say something different. And so we said, well, do you know the communities that have the greatest needs? Who are the neediest Orange County residents? And once again, we would get different answers for different questions. So I said, okay, well, I think it's about time that Orange County create a baseline. Very similar to when you go see a doctor. Something's wrong with you, you go get your blood work done, you go through a slew of tests, you create a baseline for your health. And that's what we decided to do for Orange County. Could we create a baseline so that ever after we can compare ourselves to this baseline, right? And so that's what we call the Social Progress Index. So when we set out to create the Social Progress Index, we asked ourselves, what are other countries doing? Not just like California. We were like, what are other countries doing? What's the UN doing? So they also use the Social Progress Index. And this is a concept that came about at Harvard Business School, and in conjunction with very, very bright people at MIT and the World Economic Forum, and like I said, the UN. Next slide. So who uses the Social Progress Index? You can see that there are private sector partners, there are public sector partners, there are folks here in Orange County, as well as San Mateo County, as well as Miami-Dade, Florida, as well as Philadelphia, who I happen to have connected with recently because they just launched their own equity map. So we were one of the first. I would say we are the first in the US to do what we're doing here. And so now what I want to do is hand it over to Katie Tran. She's going to tell you about the framework for the Social Progress Index and the equity map. And then I get to do the fun part, which is to tell you from that, where are we headed, right? In the world of data and in the world of Orange County, where are we headed when we talk about equity?
Well, first I want to say thank you for being here and listen to us talk about data. We're going to try to make it as exciting as possible. I love that engagement. Thank you. So, but this is fun for us. We're data people. This is actually really fun for me. I'm getting really into it. I have all my notes here. But the Social Progress Index is basically based on 3 dimensions, as you see here. Basic human needs, foundation of well-being and opportunity, and under these 3 dimensions, there are 23 components and 50 plus indicator. And it's kind of like a pyramid if you think of it. If people basic human needs are met, then they will have better well-being and then opportunity will come. So who else cares that we also present all these on a national, local, global spaces here. Okay. Just a little bit deeper into the Social Progress Index and what it means. And if you ever forget the slide, I'm going to show you how you're going to be able to access it. We don't want to just present you the data, but we want you to be able to use it as well. But of course we cannot do it without truly explaining what it is first. So under these 3 dimensions and 23 components, if you go on our website and if you click on the equity mapping tool, if you go to advanceoc.com and you click on social progress index and scroll all the way down to this area right here, it will actually tell you what each of these means and where we actually sort it from. So these are actually trustworthy data. We get it from the CDC, as it right here, the California Environmental Screening, and it also have the year and what each of this means. What you see is the Orange County Equity Map 2.0 version. This is the second version, but we're very excited that we're gonna have another version that's coming out soon, and it will be even more user-friendly and easier to use. So why is it important? As you know, when we look at data, sometimes it can be really boring in these spreadsheets, and Advanced OC has gone really far to actually gathering all these data from different resources and putting all together in one place so you're able to find it. And nobody has really gone that far to collect data and actually analyze it from a very local level. And we also make it very user-friendly. If you go on the map, you can also click on to look at the data from a census tract or in your city as well. Let me show you. If you go onto our website, this is the actual OC equity map, and I have put up Fullerton as a city. Let's see how Fullerton is doing. So if you see orange is mean high, it's mean low, and blue is mean high. Data is very logical, so if it's just blue is high, it's orange is low. It doesn't mean that it's better or worse. It depends on each of those social progress index indicator. So we look at environmental quality. Fullerton is doing really well, 89.98. You have a really high score there. Also high on inclusiveness, water, sanitation, foundation of well-being. But some of the other lower performing SPI are access to advanced education, personal safety, access to basic knowledge, and personal freedom and choice. Do we know why? So those are the questions that we really have to ask ourselves, and we also need to learn from each other and advance OC here. And we also want to, discover those reasons why, so we can better serve our community with you. Some other information we're able to gather from Fullerton is population data, median household income, and the percentage of people living below poverty. If you want to dive deeper into Fullerton, you can also look at the zip code. Also your neighborhood. You can actually type in your address and see how your neighborhood is doing. Nobody has gone that far to actually gathering data and make it user-friendly. Yeah, I got a step in today.
Yes, you are.
Okay, if we dive down, drill down Orange County to 3 dimensions. First, we're gonna have different maps. Okay, so if we look at basic human needs, at this map right here, we see the area that kind of know Orange County that is lower SPI score. They have when it's come to basic human needs. But however, if we look at foundation of well-being, we kind of see it scattering a little bit. Even though North Orange County still have lower SPI score, but then there's those areas kind of in the middle of South Orange County. So they have very different maps. And now we're looking at that opportunity. It's even more scattered. And that area that you see on the top, that's kind of not a lot, they don't have a lot of high population there. That's why there's less opportunity. And why is this? It's important because when we creating programs, services, or even advocating for policies, it's not one for all. We kind of really have to dive down to what that issue is and gathering the right information. And we cannot paint the same painting for just use the same brush to paint the same painting.
Can I ask you a question?
Yes.
So I can't see the key. So what do each of the colors mean? The light orange, the dark orange, and the blue. What do those actually mean?
Darker orange, so orange mean low and blue mean high. So darker the orange is mean the lower, and then the high
And the dark orange
yeah.
is the foundations. Where are the so?
Okay, so when we have 50 plus indicator, social progress indicator, each of them has a score, and they all have equal weight. Once we add it all together, it actually come up with one SPI score for each of these kind of dot that you have here is break down to sensor track. So the darker orange square, as we see, are the area with the lower SPI score, social progress index. Good question. Thank you.
So those areas with the low social progress index are people that have not done much improvement in their life.
So the social progress index is, like Katie said, is actually invented by the Harvard Business School, and is measure how well a local or a national or even a country provide social and environment factor that's supporting their citizen. Before, when we look at a country, we usually look at GPD, which is a gross national product, as a way to measure how well a country is doing. But SPI, but then we realized that people that actually live in these very wealthy country, actually they're not happy, they're not well, they're not necessarily having the best health. So that wasn't a good indicator. That's why the social progress index was created, invented, and very widely used by national and global. So these that you see right here is actually indicate the score of how well that area is doing in providing social and environment factors to support their citizens to do better in life. Yes.
I'm sorry, kind of slow. So that's a map of Orange County.
Yes, this is the map of Orange County.
And then on your website, does it have which areas those are?
Yeah, so actually when you go on our website, like I showed earlier, like we want you to be able to use this because that's why we created this tool. You can actually click on these dots and then find out which area it is. Yeah.
Okay, great, thank you.
Yeah. Any other question? Okay, we'll be here if you want to look at the map and explore it a little bit more later.
Yeah, 92831 where I live.
I'm sorry?
92831 is my zip.
Okay. Well, maybe we'll sit with you at the end. We want to just be more cautious of people's time, but maybe if we have more time in the presentation, we can actually look up that zip code. But there are other interesting data facts that we want to share with you, because before, we want you to understand what data and what it means and how to use the map for yourself. So that's why we're presenting this information. So like I mentioned earlier, there's 3 dimensions when it comes to the SPI and 23 components. But if we even dive deeper down into those components, we can look at health and wellness as one of the SPI component, and housing. And as we see in the map right here, it's not the same map as we saw earlier. Just kind of want to go back and compare, right? We look at basic human needs. No, Orange County is not doing as well. Foundation of well-being, opportunity. Dive deeper in now it's a different picture when we look at health and wellness in Orange County. Those area that is even South County does not have high score as we thought they might when it comes to health and wellness. And this is a picture of housing. And why is it so important for us to look at all these data and dive down to all these components? But when it comes to making policy and program, like I mentioned earlier, we have to make policy and program and services that more tailored to a certain area.
I have
So-
another question. Is there any idea why this is? Why in the farther south, why that?
These are more okay, I'm gonna use a little bit on my knowledge, right? So this is why we asking those why question, and we need our own knowledge and also your knowledge to find out why. That way we can create better policy and program and services. In my knowledge, these are more the in unincorporated area. So that's not a high population. So maybe people are more far away from each other. Don't have a lot of socialization. Yeah.
I just want to ask, what's the source of the data did you get this from?
Yeah, so earlier I showed that if you go to our website and click on OC, the equity map, there's a page called Social Progress Index, and you scroll down a little bit, it actually say what each of our indicator means and where the source is. Yeah, do you remember that page or should I? Okay. AdvancedOC.com.
Advanced OC? You can put up on your phone.
So here, this is the advancedoc.com. If you look into equity mapping tool and if you click on social progress index, you just have to scroll down a little bit. It will show our 3-dimension of SPI, and if you click on any of those components, it actually has the definition and the source of the data. So you ever need this to, support any of the grant you're writing or program that you need data for, you can actually sort the data.
Social Progress Index?
Yes, social progress index.
I have a question.
Yes,
Does this include the senior survey that went out this last year? Is that data that you collected from that?
yeah, thank you for asking that. So we actually Advanced OC were the one that behind the older adult needs assessment, and I want to thank all of you for truly, supporting us in that effort and helping us reaching our goal when it comes to the survey. So currently the survey has ended, and we are in the process of cleaning up the data and also analyzing it. And we will, work with the county on presenting to the public later.
Okay, so today wasn't, thank you.
Yeah, it just
Today
ended.
wasn't presenting, right?
Yeah, the survey just ended the end of this year, so on December 31st.
Thank you.
But yeah, I'm very excited to hear about it as well and presenting it to the community.
No question. Sorry.
I like this collective.
I just wonder, it seems to me like we've done a great job collecting a lot of quantitative data. Is there plans to actually find out the why as to why there are those differences? So is there a plan or grants or whatever to collect the data to identify why those areas are not doing as well as others?
So I think that's up to all of us, right? Because then Advanced OC, that is truly one of our goals. We value both quantitative data and also qualitative data. And it's actually proved to one of the other projects that we work with that I'm going to present later. It's called the Equity in OC. We actually created 6 population overview data on population that hasn't been presented, before, like the LGBTQ or the older adult, the Black community. And we didn't just collect quantitative data, but we also were there meeting the people and asking them why are this reason to put into the qualitative data. So through our data collection, of course, we first will get the quantitative data, but then through our engagement face to face with the community member, and we also need you to also tell us why. This is a collective effort to encourage no conversation.
That's good. The data is great and the street level outreach stuff is great. But how are we gonna put it into practice? Right? And like, I know we're supposed to meet, it's supposed to be a collaborative thing, but where does that start? Where do we do that, right? How do we access you? Who's our point of contact? How do we start having these conversations to take this to the next level? Right? Because data is great. We've been doing this for decades here in Orange County,
Yeah,
as we all know and are all aware of. Not to knock this by any means,
Yeah,
but
yeah.
we need action.
yeah, so I think we can look at the data first and then, and then see where the needs are and is that supporting what we already know from the community. And then together, maybe as a collective here in Fullerton, you will be the one that behind advocating for the concept, maybe talking to the city council, local government, or creating even program. It's gonna take, a village. But we just providing you with kind of the truth, the data for you to be able to do what you
So
need.
you
Yeah.
guys are the conduit that would help us connect those.
Yeah, so our goal is data, action, and impact. So we kind of working on the data because we saw that what was missing in the community just to be able to gather the valuable data. But we're looking forward to maybe getting to some of those action as well. And we are doing that with some of our other projects, but of course there's a lot of needs out there and we have to be cautious of what we can and cannot do.
And I would
Yes.
just interject that,
I'm so sorry. I have to jump in here.
Yeah.
Yeah, this is so, you just threw me a softball. Like I have to. So I'm, for those who don't know, I'm Councilmember Shana Charles. I'm on the city council here in Fullerton. I am also a Cal State Fullerton professor in the field of public health and public policy. I teach data. This is gonna go into 2 of my classes. And I do those studies. So I would say find more people like me, but we have universities, and Georgia also can speak to this as well, in my department and with the Center for Healthy Neighborhoods. We have whole colleges, like the College of Health and Human Development and the college, like those are the folks who want to work to get the grant. We have grant writers to get the grants from the Robert Wood Johnson Foundation and the California Endowment and the California Healthcare Foundation and all these foundations and the John Randolph Haynes and Dora Haynes, they all want to fund community-based partnerships with academic work. And we all need those grants. So we've got to make more of these connections, and that is exactly why I'm here.
Cheers.
But I shouldn't be the only one. We have teams that are interested in this. We have literally dozens of faculty members that would love to work with you, not just at Cal State Fullerton, but also at UC Irvine, where they just launched a new school of public health as well. So yes, let's do this. Like, this is great. And thank you for the data.
I really love the collaborative
Can I also say that
environment here.
for all of us, this data is a very transparent. I mean, we have it available to us. And it is something for us to take to our
Yeah,
policymakers to say, look, we know what's going on.
Right.
You have to act upon to help this area or in this, so it makes us all kind of part of the process.
Yeah, you're showing us the areas that need to be served, and whatever foundation or whatever area we're able to serve, that'll be our area. Be able to make a difference.
And trust me, this is something that you already know, like these data just validate what you already know about your neighborhood and community. So we just giving you kind of the data so you can make the statement stronger. But you already know this.
And can I ask one question about the data, just because I can't find it on my phone? I think the website doesn't necessarily translate to phone, but for the health and wellness, are you using the California Health Interview Survey data? Are you working with them at UCLA? Because they have all of that data they've been collecting for 20 years.
So CHIS,
Yeah,
what you're
CHIS
referring
survey.
to, CHIS, CHIS, it undersamples Orange County. So unlike San Diego County and LA County where they oversample those populations, Orange County has never paid up for it. So that's something that we have to rectify, and that's something why we can't rely on CHIS for Orange County, because there's an undersampling. So we actually advocated for the Orange County Healthcare Agency to pony up the dollars to oversample in Orange County. We are about the same size as San Diego County. And the fact is that our data is lacking in CHIS. CHIS only has 500 or so interviews from Orange County, 3.2 million people. And we only have 500 or so interviews. So we can't really pull from some of those sources, but we tried our best to pull from as comprehensive as sources as we can. And we scour not just national databases, statewide databases, and all of our local agencies as well. So they participate with us to the extent that they can. Good question.
And hopefully we can get them to, I'll work on that.
Can you? Yeah.
Oh, yeah, no, I was there. I'm their director of health insurance studies. at
Yeah.
UCLA, Center for
Yeah.
Policy Research, and I'm going to their I'll be on the TAC committee. But we have to put up the money. I mean, that's the problem. The board doesn't put up the money. No.
Yeah, next year, actually, there is a mandate that the county as well as Cal Optima has to come together and do one assessment, community needs assessment. We would love to see that happen in that year so that we can have an oversampling of CHIS data. There's a lot of good data from CHIS that we'd love to be able to use.
Good conversation, and even though we try to collect as much as possible, but data is also missing. Like we can look at this gray part right here. That just means that there's no data presented, or like I mentioned earlier, there were population in Orange County that has not been, that we have not presented any data on them before, and those are kind of up to us to advocate for those communities, so they would also be show up in the data.
What are the reasons to not be able to collect the data for that area?
Maybe it just hasn't been an issue before. As we know, like DEI has not been an issue before, right? Not until the year recently, and then people started to care about the population to be show up in data because we need to care for them. So I think that could be one of the reasons, and I'm sure you guys know many other reasons as well. I know I know we have a short time, but I love the conversation here. But that can you let me know
About 5 more minutes.
Okay. So we also gather up the top 50 city census tract with the highest score. You notice right here, Cyprus has the highest score of 70.57, and we also put together the bottom 50 census tract. We're not really comparing city to city. Every census tract, neighborhood have their own challenges, right? But why we put them together like that? Just so we can learn from them. Like, what are the top 50 doing well? Like, why are they thriving? And what are the 50 bottom? Why are they on the bottom? What are some of the correlation there? So what work in public health, how are we able to use this map when it comes to the pandemic? If you look at the map right here, this is the Orange County equity map, and that yellow area right there is where the low SDI area is. And if you know Orange County, that's kind of where most of our minority community live, people of color, and this is South Orange County. And when we lay this map with the COVID cases, those areas with the low SDI is actually the one with the highest cases. And Santa Ana, in example, is a very young city. It doesn't make sense that they are the one with the highest cases, right? But then now we're looking at other elements like there might be a higher population, there are more people that working in essential services, so they cannot take time off. So those are the things that we were able to work with the Orange County Healthcare Agency, and they able to put the mobile vaccine clinic in those area right there where the low SPI is to bring Orange County out of the pandemic and into a safer percentage of COVID cases. So why social determinant of health matter? If we really look at how a person's well-being is, only 20% of our well-being is happening between the four walls of the doctor or hospital. The other 80% based on our health behavior, physical environment, and social economic factor. So why should a person go to the doctor, get treated for a condition, and then we send them back to the environment that makes them sick in the first place? Right? So now, why not treat also the neighborhood, the social, the environment, and then treat a person's health? So just another different example into the Orange County Health Equity Map. This is kind of, you know, that's Disneyland, so there's no data collecting there. That's why it's great. But these two areas right here, they just across from each other, maybe 15 minutes away from each other. But if you live here, you're gonna live a little bit longer. You're gonna live to be about 89 years old. But it's look, this is a little bit above Santa Ana next to Orange. Okay, but however, if you live here above Disneyland, you will have a life expectancy of 75 years old. Why is that a disparity? Again, touch base on building of truth and trust. Data give us the truth, but then we also need to build trust. That's how we're gonna work with each other, the community build trust. So we want to build this culture as an advanced OC of using data, also building trust in the community. And we are able to do that through equity and OC with the healthcare agency, where some of you might be a part of that effort already, where they actually encourage community leaders to come together and work on issues. They selected the whole community using data as well, selected on 3 issues that they want to work on, which is mental health, health and wellness, mental health, housing, and also food insecurity. So we always know there's a great Hispanic population in Orange County, but if we just look at all of them as Hispanic, we really not truly understanding the community. The Hispanic community is very diverse, and through equity and OC, we were able to come up with a population overview, as I mentioned earlier, of the Hispanic Latino population in Orange County. And they are so diverse. There's Mexican, there's Salvadorian, and why is this important? Because each of these Hispanic origin people will have different needs, will have different history. How we reach out to them, how we create our policy is very unique for this population. We cannot use one strategy to just for all Hispanic outreach. Okay. So now we ask the question, show me the census tract with more than 75 Hispanic Latino in Orange County. If you look at the dotted line, that's the county median, and just a straight line is that the Hispanic median. Now we're looking at that population. We can see that the population has a higher rate of lack health insurance among adults of 18 to 64 years old.
It has what?
So the Hispanic and Latino has a higher rate when it comes to lack of health insurance between the older adult 18 and 64 years old. Yeah. If we just look at the county, we cannot say, okay, we're doing pretty well as a county. There's only 10% of older adults people that are over 18 years old that lack health insurance. But we have to look at, is it true for the Hispanic community? 30% of that population is lack of health insurance right now. Are they up to date with their preventive care? Again, the Hispanic population has a lower rate compared to the county. So those are just some of the way that we're able to gather data and make it more specific toward a population such as the Hispanic and Latino. We even dive deeper into the Mexicans. What are their rates? What are the challenges that they have? They have a little bit, most of them, 32% compared to 30%. So the Mexicans population actually have 32% that lack of health insurance compared to the Hispanic is 30%. Now we want to look at the data and say, show me the census tract with lowest preschool enrollment. And we find out that if we pull up those census tracts, it actually correlated to other indicators like the census tract with the lower preschool enrollment somehow have a higher of adults that are smoking. Is there a correlation there? Should we invest in more low preschool in order to encourage people to smoke, to have less smoking? So those are the questions and correlation when it comes to data that we need to make in order to create better program, better solution as community leader.
Is that data that you just showed on your website as well?
No.
Yeah, so those are the ones that we analyzed.
So we do a lot of work with hospitals, and we do a lot of work with CalOptima, looking at their member data. Some of these things are private, not for public consumption because they're so technical, right? What we just showed you was basically, what are the factors? And the gentleman who asked, why? Why are those two neighborhoods, when they're so close to each other, why are they experiencing such different outcomes? And that's what we do day in and day out. And we ask those questions. So when we work with hospitals, they say to us, what is wrong with our population, the people that come to our hospital? And then we drill into the data and we try to find the answers. So we are working on it. We may not be working on it for every city. We'd like to. I'd love to be able to have a staff every single city and investigate those things. We're just not there yet. I'd love to do that. I'd love to partner with our universities to be able to explore that. But that is so technical. It's hard to release that without like a huge primer, like a huge education effort, right, to try to explain that. But if you are interested in that and you want us to present to your cohort or spaces, we would be absolutely happy to.
Will these slides be available?
Yeah, we can share it. Yeah, for sure. So I just want to talk about this, Katie, if it's all right. When we think about Orange County and we think about how do we make policies, if it's the county office doling out dollars for the county, how do we best target the people that are going to be most impacted? So we do something called clustering, where we look at all of those different characteristics and traits and we say, who looks like one another? Never mind the city boundaries, never mind the zip code boundaries, right? If we throw all of that out the window, those are arbitrary anyway, right? Somebody does redistricting and voila, there's another city or another zip code. If we throw all of those things out the window, what neighborhoods actually look like one another? And so this is a map of Orange County. If we were really to track how similar or how different. So if you look at Santa Ana, for example, you may think that there's a cluster around Santa Ana and they all will respond to the same thing. Not true. If you look at the map, you'll see up in the sort of like the teal blue, those are individual neighborhoods that resemble each other, but we never treat it as a cohort. We never say, okay, I'm gonna do an anti-smoking campaign. And we never say, where are the smokers in Orange County? We just say, go throw up some flyers over here. Go put up some billboards over there. Hopefully the entire county gets covered. But we gotta be smarter than that. We're running out of money, guys. You know, money is not like infinite, right? And so we gotta be smarter. And we have the data now to be smarter. So why don't we? And
Well,
that,
I think we gotta get as smart as the tobacco and the alcohol companies and do the same data research that they're doing and
That's right.
putting up billboards, et cetera, right?
That's right.
Because they're doing a great job.
That's right.
Their
That's right.
targeting audience is being affected by it.
yeah.
It has been for the last, 50, 60 years or 100 years, right?
So you just spoke to the reason why Advanced OC was created. So we are the good guys trying to fight the bad guys
That's right.
Yeah.
with data. And our weapon of choice is data.
Yeah.
But isn't it a problem though, I think from a public health perspective, because the usual practice is like, we'll create a program and just disseminate it, it's gonna work for everybody. Like, and I'll give you an example, my dissertation was in disaster preparedness and specifically earthquake preparedness. And I went to Oklahoma, where Oklahoma is not a high seismic area, right? It's not like California, where it has a high seismic risk naturally. Yet we took the policies from California and we implemented it in Oklahoma. And of course, they don't work. In fact, that's why I went there to ask them why it's not working. And guess what? People there deal with tornadoes and hurricanes and like that, like all kinds of stuff that we don't deal with here, and the architecture is different. And I see the same thing happen with every single problem. Like why do people smoke? I can smoke because I like it. I can smoke because I'm stressed and I don't have money and this is my only coping mechanism. So when we're targeting campaigns, it's not just the campaign, you have to customize even the campaign. Not just
Right.
like, it cannot be just smoking campaign, it needs to be targeting the actual people
Well,
in order to have a result.
Remember when we showed you the difference between just lumping everybody as a Latino, Hispanic,
Right, exactly.
and then breaking it down by sub-ethnic groups? That's what we mean when we mean targeting, right? Because we have to get that precise. The state of California is doing, and I'm going to spend a couple minutes talking about where we're going next, okay? And this will answer some of your questions. State of California is doing something called the California Initiative to Advance Precision Medicine. It all comes down to the Apple Watch you wear, the Oura ring you may have on your finger, whatever it is, you're being measured. The sleep that you have, your heartbeat, all those things, right? It's being taken in. And so what they want to do is say, okay, can we personalize medicine? Just in the way you're just talking about personalizing policy, can we get to a place where we're talking about public policy as a way to do smarter public policy by understanding the circumstances around the neighborhood that is around you versus the neighborhood that's around me, right? The behaviors that you have versus the behaviors that I have. So we're working on a couple of initiatives I want to tell you guys about that you can expect us, maybe we can come back and talk to you guys about. One is called the Youth Vulnerability Index. And for a long time, our kids suffered during the pandemic, and we don't really understand what are the long-term ramifications of that. We have no idea. Some kids flat out didn't come back to school. And there's some, families that have been forever devastated by the pandemic. Chalk and Advance OC came together. We decided we're going to study that. I try to identify who those at-risk vulnerable kids are and their families, and we're going to be proactive about it. First of all, population health data, all the stuff that you saw that we're presenting does not exist for the pediatric population. Does not exist. So we got to first find the data. Then we got to put together a formula to try to figure out, who's hurting and where are they hurting and why are they hurting. So that's an initiative that we're working on with Chalk as well as other institutional partners here in Orange County. We're also doing something called the social determinants of justice. Why are legal outcomes different? Whether you're going to court in Santa Ana or going to court in Fullerton or going to court in Newport Beach. Let's investigate that a little bit. And you can see that can be a little, hair raising, right? But understand, it's all about the injustice of place. It's all about where you live, where you're born, where you work, where you play, where you worship. It's all about that. And so if we can talk about that openly and discover these correlations, we can better understand how to fix some of the problems that we have, yeah? But if we live in kind of a data void and we don't start to understand those things, we're never going to be able to arrive at these systemic changes that we seek. So a couple of things that we're doing. One other very tangible things that you might be interested in is we're piloting a new program for the healthcare agency that's centered around access to mental health, culturally competent mental health providers for the Black community. And earlier you guys said, okay, what are you doing? Like, you're collecting the data, well, what are you doing to actually change outcomes? So we went to the healthcare agency, and we said, we have an idea. There's a shortage of Black nurses and doctors, a shortage of Black healthcare providers and mental health providers. And one way to bridge that gap is to invest in community health workers. And what if we could train our barbershops and beauty salons, those technicians that work in barbershops and beauty salons, for mental health first aid? And that is something that we can really do through the CHW program. And we can say, we're going to train you, you're going to understand it and be able to identify mental health flags, and be able to give them resources or direct them to care, right? So the data that we collected on the Black community last year, we did a community health needs assessment with the Black Collective, very similar to how you guys are doing it around Fullerton. We work with the Black Collective, and they identified mental health as being their number one concern. So then we went and did a pilot program with HCA and said, let us do this. Let us see if we can fill the gap of mental health care professionals in the Black community and serving the Black community, and see if we can improve health outcomes for the Black community. So we are connecting the dots. We're probably not connecting as many dots as we should be, or we could be, or all of those things. We wish we could do more. We always wish we could do more. But I think that's the next thing, is we are now all empowered with data. We have to ask ourselves, what can we do? What part can we play? And then we welcome all of you to partner with us in some way. Thank you.
Thank you so much. So I just wanted to add one little addition, is that in Fullerton, if we were to go back to the map of Fullerton and you saw the north and south Fullerton and the diversity, we are connecting those dots in our subcommittees. And so I'm going to invite Peter, I'm going to invite Lisa, and Bev to come and join us, just to report out the subcommittees, and we're connecting those dots. And that's why we invited Advance OC here, because we are looking at that data, identifying those gaps, and identifying and addressing that in our subcommittees. So we want to invite you to the work that we're doing.
Okay, so with that, who wants to go first from our subcommittees to report out? Bev, you want to come on up first?
Sure, you want me to come up there? Okay.
Next is Bev representing our Next Gen Subcommittee.
Speaking on behalf of the other two that are here, we've divided and we all are part of this committee. So it's Amy, myself, and David. We haven't met lately. I haven't met lately. They've met a couple of times. Our next meeting for Next Gen is on the 31st at 1 p.m. It will be virtual. And what we're hoping to do is survey other organizations out here that serve youth, to find out who you serve, the numbers that you serve, the age ranges, so the age range of who you might serve. So for instance, we've got our high school represented here. So, in your high school, how many students you have, what's your age range, the same thing with maybe the Boys and Girls Club, the Y, whatever group here that serves our youth here in this community. What our goal is to do is to move forward in providing or establishing a youth committee to be able to serve for us, because again, it's empowering, it's allowing our students or our youth voice to be part of what goes on in our city. So we're looking for those numbers. So if you want to send them in through Deborah, she can refer them to us. If not, we invite you all that would like to come to the 31st at 1 p.m. It will be virtual, so we will send out the link.
Thank you. So if you work with an organization that represents the youth in our city, please give that more data to them and either go to the meeting or connect via email to get that information. All right, next we have Lisa with our homeless task force.
Hi, everybody. Just an invitation. Our next meeting will be January 16th at 1 p.m. Location is TBD, but normally we meet at the Hope Center. Previously, we haven't met as a committee in a while, but Jason Phillips, who I co-chair the committee with, helped facilitate a Homelessness 101 that took place on December 4th. And so we kind of need to kind of get some energy at the table and restart these efforts. So if you're interested, please contact me or contact Jason Phillips. We'll get you involved. There is a call out for volunteers. So we're talking a lot about data. There's going to be major data collection called point in time count for our homeless neighbors. They're looking, the county is looking for volunteers January 22nd through the 25th. And there's different types of volunteer roles that you could fulfill within the point in time effort. You can be out in the field, training, you'll be trained actually making contact with members of our homeless community, or you can work in the centers where like the volunteers gather. So there's different levels of volunteer work, and if you're interested, the website would be everyonecounts.org. So I encourage you to go to that website and learn more. And that's all.
Thank you so much, Lisa. So again, if you're interested, that task force, they've been kind of on hiatus, just trying to get their, figuring out what their goals and objectives are this year, but we're ready to meet again. And so this would be a perfect time for everybody to re-engage. So please show up to that meeting in January. And last, we have Peter with our health and wellness.
Good afternoon, everyone. So just a quick announcement, as you all probably may recall, at the end of last year, we hosted on behalf of the subcommittee the Move More Mindfulness Challenge, which really focused on the objective of addressing mental health stigmas out in the community and really kind of empowering the community to integrate different self-care and mental health practices into their everyday lives. With that said, I did want to announce the winner of that challenge. So our winner for that challenge was Karime Calixto. So she will be awarded a $100 gift card. So congratulations to her and the thousands of participants that we had for the challenge. As a subcommittee, we've also been working on a platform, really kind of streamlining and gathering all of the different mental health resources that are available in the city of Fullerton. And so our subcommittee is in the process of finalizing that data and that information. Our next step is really to kind of vet and really check in on the different organizations that are offering resources with the city, and really confirming to make sure that when people in the city are reaching out to the organization, that they're actually offering those services. And so once we completely finalize that resource, our goal is to disseminate all that information to partners, the city, the school districts, and any partner individual that would be interested in that resource. With that said, my last announcement is that we have officially launched our new challenge, which is called the New Year, New Me Challenge. If you're interested in learning more about it, we have the flyers in the back. But I think the biggest thing to communicate is that we're very much focused on creating customized goals with the community. As Katie mentioned, it's different, right? Different concerns, health concerns are different throughout the city, and one might not necessarily be consistent across the city as a whole. And so really empowering the community to prioritize their well-being. Thank you.
Are you gonna do early childhood,
Yes.
maybe?
I'm just gonna announce the dates there. If you want the Zoom link, send me an email and I'll send that to you. So, and then also become a member. If you're not a member, the members are listed at the bottom of your agenda. If you're not there, if you want to join us, we would love to have you as a member. So let me know and I can send you over the PDF. So.
Perfect. Okay, we have just about 5 minutes left for any member announcements. Do we have any member announcements?
Hello, and Happy New Year.
Yeah.
So I see a couple familiar faces in it, and I just want to say it's really re-energizing to see the passion in this room when it comes to these problems and how you guys want to address them. And because of that, I should actually introduce myself. My name is Michelle. I'm a field representative for Assemblywoman Sharon Quirk-Silva. I know I keep wanting to refer to you as Councilmember Dr. Charles. Councilmember Charles, you are one of the keys to connecting our community to our assembly member. And so thank you for being a champion for public policy. But now back to the topic of moving more this year. Assembly member Sharon Quirk-Silva would like to cordially invite all of you guys to our walk and talk here in Fullerton on February 3rd. I've left flyers back there if you guys want to join us. We would prefer that you RSVP so that we know how many cups of coffee we should bring. But besides that, it's open to the community. If you guys want to take one and share that with your own community, we're open to that as well. And we'd love to see you all there. Thank you.
Thank you. Any other announcements? Sure, I'll move around the room now. All right, we'll go over here.
Hello, Father Dennis Chris from St. Philip and Easy Parish. Just want to plug our second post-COVID the St. Valentine's Day dinner dance that we're going to have in our parish on the 10th of February. Tickets are $40 per person. It was a nice event last year. We'd like to invite the folks to participate as well. Thank you.
Hi, I'm Jennifer, and I'm here representing High Hopes Counseling. We're right here in Fullerton. We do reduce the mental health services, and we have flyers in the back. We have one more date this month. We're doing vision boards, and if you've never done a vision board before, it's where you put all your hopes, your dreams, your goals on an actual physical board, and it really helps to manifest what you want to do for the year. I very much believe in them, and we're doing one more date in January, and there's a little flyer back there about that. And then we're also doing our second annual Galentine brunch, ladies only, Valentine, celebrate yourself. And it's our biggest fundraiser of the year, but it's also a way to make yourself feel special, and maybe a sister, a friend, a family member, a mom. So the flyers are out there if you want to take a look at them.
Hi, everybody. I'm Georgia Hilgani. I'm currently serving as the Director of Operations for the Center for Healthy Neighborhoods. And I just want to announce that on January 22nd, 23rd, and 24th, we're going to be doing our registration for the Academic Success Program. So what we do is we get Cal State Fullerton seniors, and they do their internship in our center. We literally handpick every single one of them, make sure that they have what it takes to provide the tutoring, and we provide free 1 hour one-on-one tutoring to kids who struggle with school. We can help them with Spanish homework, with English homework, whatever they need. So again, all our services is for free. There are flyers back there, both in Spanish and in English. There's a QR code, and people can provide us with their email, and then we can provide you, I guess, with more information. But essentially, 22nd, 23rd, 24th, that would be the registration date. This way, I know how many interns to recruit. And then also in February, we're going to start again the baby developmental classes. So those are geared mostly to young parents, so they have babies from 0 to 24 months. So we provide free developmental screenings. And also the professor provides them free advice as to how to they feed, how to exercise the babies, and so on. Thank you.
Hello everyone, my name is Milaka Sanyada. I'm the Elder Abuse Specialist at Radiant Futures. So the month of January is actually Human Trafficking Awareness Month. And so Radiant Futures will be hosting a pop-up event right in our backyard. We are right down Amridge, between Amridge and Pomona. So please come and support. We'll have a bunch of vendors there. And then also we are starting our 40-hour DV training if you would like to become a domestic violence certified counselor.
My name is Walt. I'm with the Fullerton Lions Club, and every year we sponsor chess. Upcoming, tentatively right now, February 10th, at Morrison tournament we have. Any school child from kindergarten all the way to seniors in high school are welcome to come and play chess. And it starts at 11 a.m. at Ladera Vista Junior High, and the school district is providing the locations. And we usually get a couple of hundred kids, but before the pandemic, after the lockdowns, we'll see if everything is the same. But if anyone know a boy or a girl that likes chess, come on, and they can enter the contest. And we'll give out medals for the winner.
Hi, everybody. My name is Linda Kramer, and I'm the Community Engagement Manager for OC Power Authority. And we are your clean energy community power company in Fullerton. And I want to just share a couple things. We're very interested in sharing any way to reduce energy costs, especially with some of our lower income customers. And so I have 2 flyers back there on smart thermometers, which have many, many rebates right now and really help customers save about 10% on average per month. And then many other things like LED lights, which again can save a lot of energy. I also wanted to mention that we're looking for Fullerton, the city of Fullerton voted for most customers are at 70% renewable, which helps with health in an incredible amount. We're hoping to get every city to just clean up our air. But if you are a business or know a business that wants to be noted as a green champion and is choosing one of the higher renewable levels, please come see me. We'd love to talk to you. We also wanted to mention that our lowest rate is 2% cheaper than your current investor on utilities. So we want to make sure everybody is in the Orange County Power Authority.
Hi, I'll keep it brief. I just wanted to mention, for those of you who don't know, that I do open office hours as a council member. They're on Thursdays from noon to 2. I am always available to anybody who wants to talk to me, and often I'm sitting there by myself. So I am right now still in City Hall, starting in hopefully in February. I'll be publishing a calendar. I'm going to have 1 a month in City Hall and the rest at other locations around the community. If you want me to host one at yours, I'm happy to do it. If you think there's people that would love to talk to me on Thursday from 12 to 2. So please feel free to reach out, and it's shana.charles@cityoffullerton.com, or please just feel free to walk in and talk to me.
I'm Rosa Maria Gomez Amaro, and I'm with the YWCA in Orange County. I have happy news. We have a modest grant that from the U.S. Bank. Yay for them. We see them all over the county now. And this will be to expand our youth employment services program, which is a workforce development program for teens. We will now be able to hire paid interns, looking for those that are in school, either looking for an academic internship that allows them to be paid, or those that just need to get the academic credit. But we will have some, to be able to have people placed within the Fullerton Joint Union High School District. That's it. Contact me. Who's next?
You have to be our last one.
Oh,
So this is all about health today, I guess, and I don't know I don't know how healthy our particular town is, but in our zip code, but we have a holistic health fair. It's absolutely free. It's on February 18th at the Elks Lodge, and it's from 11:30 to 3:30. So it's like an open house. Just come in and enjoy all of the speakers.
11:30 to 3:30. Elks Lodge on, in Fullerton, right there by, Bramble, right.
Those of you that are interested, there's going to be a veteran stand down for homeless veterans, and it's going to be at the Garden Grove Elks Club on the 24th, which is a Saturday of February. Runs from 10 until 3, and a lot of resources for veterans that are in the homeless situation. So if you know of any of them, you pass it on. I appreciate that.
And I just want to remind you, if you did not already sign in, please do so. If you would like to sign in, you will get a copy of the PowerPoint. So if you don't sign in, and I can't read it, you're not going to get it. So that's just a reminder. And I also just want to do a plug out. We launched the Fullerton Community Foundation, which is the charitable arm of Fullerton Collaborative. We are going to be reaching out to our members to look at where people can donate to your organization. So just be on the lookout for that. We are trying to bring funding to Fullerton. So we are excited to be able to have that. And thank you for joining us at the Plaza. First night was a blast. We had a lot of fun. And thank you for those that donated items. We had a great time. So thank you, everyone.
And with that, thank you for an amazing meeting. And we'll see you back here next month. Have a great January, everybody.